Good morning, students. In our last class, we had learnt about the definition of circulatory shock, right? We had learnt what circulatory shock is. Also, we learnt the different types of shock, the causes for each type of shock and their pathophysiology. So today, we are going to the next section of this, that is the stages of shock. So today's learning objectives, we are going to learn about just an introduction to the stages, various stages of shock, and we'll learn in detail regarding the non-progressive stage of shock. Here we'll learn about all the negative feedback mechanisms involved in this, and these negative feedback mechanisms are further divided into rapid, intermediate and long-term mechanisms. We'll be learning about a few of them and then we'll summarize today's topics. Okay? So let's move on. So we are learning stages of shock in the context of hypovolemic shock, which is the most important topic as far as your exams are concerned. So stages of shock, the first stage is the non-progressive stage or the compensated stage of shock. Just as the name suggests, it is non-progressive. That means there are mechanisms activated within your body. The homeostatic mechanisms in your body are activated such that it will not allow the shock to progress. So the chances are that the patient will recover on his own even without some therapies being introduced. Next stage is the progressive stage. Exactly, just what do you think, what do you understand when you hear the name? Progressive. So the shock progresses. Shock progresses and it can become bad, or it can be, the patient can recover if proper therapeutic interventions are given during this stage. So there are so many mechanisms acting which makes the shock progressive, and most of them are vicious cycles. Vicious cycles means they are positive feedback mechanisms which will start at one point and the result causes further aggravation of the cause. So those mechanisms act in the progressive stage. And during progressive stage, if you're not intervening, if no therapy is given, or sometimes even with the introduction of therapy, shock can become worse and it can reach into the irreversible stage or the refractory stage, where any amount of therapy you give, you cannot save the patient. So now let's move on and learn in detail regarding each stages. First, we are going to learn about the non-progressive stage of shock. So as I discussed, it is a lesser degree of shock, and there are many negative feedback reflexes operating during this stage which prevents further deterioration of the circulation. And the shock is not severe enough here to cause its own progression. That's why the person eventually recovers in most of the cases. So here, our non-progressive stage, we are considering the non-progressive stage alone. There, many negative feedback control mechanisms will occur, which will help to return our cardiac output as well as our arterial blood pressure back to normal. That is the basic pathophysiology of all types of shock. The cardiac output is lesser, the BP is less, so that has to be brought back to normal, and for this various negative feedback mechanisms will be acting. And these mechanisms, we are dividing them into rapid, intermediate and late mechanisms. So first we are discussing about the rapid compensatory mechanisms. So the rapid compensatory mechanisms are the baroreceptor reflexes, the chemoreceptor reflexes and the CNS ischemic response. These are the main headings. Does that ring any bell? Yes, of course. You have learned the same things in regulation of blood pressure. It is the same thing. Here basically what has to be done? The BP has gone down, so it has to be brought back to normal. Basically it is nothing but regulation of blood pressure. Okay, so let's just brush up those topics even though you have learnt it already. Baroreceptor reflexes. So, you know, which are the most important? There are many baroreceptors, of which the most important are the carotid sinus receptors as well as the aortic arch baroreceptors. Those are the most important baroreceptors. And what happens when there is less stimulation of these receptors due to a lesser BP? When the blood pressure is less, the stimulation of these baroreceptors would be lesser, right? So what will happen when the stimulation of baroreceptor is lesser? The impulses which are being given to the nucleus tractus solitarius would be less. So NTS is less stimulated. Now, when the NTS is less stimulated, the glutamate produced there is less. So NTS cannot properly stimulate your CVLM or the caudal ventrolateral medulla. CVLM is not properly stimulated now. And when CVLM is not stimulated, what does this do? It usually secretes GABA and inhibits the RVLM. It usually secretes GABA and inhibits RVLM. So So that is what it usually does. It inhibits RVLM. But now what is happening? Your CVLM is not properly stimulated, so it cannot inhibit RVLM properly. And the action of RVLM is now uninhibited and it increases basically. And what is the action of RVLM? RVLM's action is always to stimulate the IML neurons. The IML neurons are stimulated by RVLM, and IML neurons, they stimulate all the sympathetic outflow. They are the point of sympathetic outflow. They increase the sympathetic activity. So when RVLM's activity increases, IML activity increases, and the whole sympathetic outflow in the body increases. Sympathetic outflow increases means what all will happen? As far as heart is concerned, the heart rate increases, the force of contraction increases. When we consider the blood vessels, what happens? There is more and more of vasoconstriction. Then adrenal medulla, the sympathetic supply to adrenal medulla, when it increases, it starts secreting more and more of epinephrine, norepinephrine, etc. This is about how the sympathetic activity is increased when blood pressure comes down via baroreceptor reflexes. Now, not just the sympathetic activity increases causing all this. There is a decrease in parasympathetic activity also. We will see it here. So, you know, normally what happens? NTS stimulates the parasympathetic centers. Which are the parasympathetic centers? Your dorsal motor nucleus of vagus as well as nucleus ambiguous. So, it's shown here, the nucleus ambiguous and the DMN, which is shown in the green color. They are the parasympathetic centers which are normally stimulated by NTS. But now, the baroreceptor reflexes to the NTS is very less. The baroreceptor impulses, the afferent impulses are very less. So, NTS is not stimulated. So, they are not stimulating your dorsal motor nucleus of vagus as well as nucleus ambiguous is not being stimulated much. So what will happen? Vagal activity is less. And what is the end result of a lesser vagal activity? Heart rate increases. Yes. So this is also causing an increase in heart rate. So this is the same thing. So when the BP is low, there is decreased stimulation of baroreceptors, decreased impulses through the buffer nerves, and less activation of NTS. When NTS is less activated, the CVLM and IVLM, they are less stimulated. What is CVLM and IVLM? Caudal ventrolateral medulla and intermediate ventrolateral medulla. And that causes less inhibition of RVLM. They usually inhibit RVLM, but now their activity is less, so they cannot inhibit RVLM properly, and there is an increased sympathetic tone. Increased sympathetic tone will increase your heart rate, will cause vasoconstriction, and stimulate the adrenal medulla, all leading on to an increase in blood pressure. Similarly, when the nucleus ambiguous and DMN, they are less stimulated, there is a decreased vagal tone which causes an increase in heart rate, further increasing the BP. This is about how baroreceptor reflexes help out during this situation of non-progressive stage. Next, we move on to chemoreceptor reflexes. We have learned this in detail for regulation of blood pressure, just brushing that up. What are the chemoreceptors, most important chemoreceptors? They are present on the carotid bodies and the aortic bodies, and they respond to change in oxygen concentration or hypoxia, that is a reduction in PO2 or an increase in PCO2 or an increase in H+ or a reduction in pH. They respond to all this. So when any of this occurs, chemoreceptors will be stimulated. We'll see what happens here. In acute hemorrhage, when the blood pressure is less than 60 millimeters of mercury, in those cases, many red cells are lost, and when RBCs are lost, the oxygen carrying power of your blood is lost, as well as there is a reduction in blood flow to the carotid and aortic bodies due to a high reduction in blood pressure. The amount of blood flowing through the carotid and aortic bodies has also come down. So basically what happens? The chemoreceptors present there will now be stimulated due to the anemia, the stagnant hypoxia, and the acidosis present locally. And that causes respiratory stimulation as well as excitation of VMC. So how these two things? Yes, we know in respiratory regulation we have learned that chemoreceptors, they not only cause cardiovascular changes, they also cause respiratory changes. They have supply to the respiratory centers, and when chemoreceptors are activated, the respiratory centers will be activated such that the rate of breathing increases. Also, they'll go and excite your vasomotor center, that is your RVLM part. It will excite the vasomotor center, thus causing an increase in heart rate and basically increasing the sympathetic outflow. So this is how chemoreceptor helps us during the circulatory shock, the non-progressive stage. Next is CNS ischemic response. So again, it elicits powerful sympathetic stimulation throughout the body. How? We'll see. When the blood pressure is less than 50 millimeters mercury, when it is really less, the cerebral perfusion, when the pressure is too less, the perfusion of your brain also decreases towards the end. So blood flow to the brain decreases means VMC is present in your brain. So blood flow to the vasomotor center is also less now. And there is strong excitation of neurons in the VMC initially because of the lack of blood supply to the vasomotor center. There is strong excitation of the neurons in VMC. And what happens? So there is strong sympathetic stimulation, and this causes vasoconstriction and other sympathetic changes. Okay, so that is what happens in CNS ischemic response. So with that, we finish off the rapid compensatory mechanisms. So it was divided into baroreceptor reflexes, chemoreceptor reflexes, and CNS ischemic response. Now let's move on to the intermediate compensatory mechanism. So intermediate compensatory mechanism is divided into our renin-angiotensin mechanism, the reverse stress mechanism, and the capillary fluid shift mechanism. So first let's see renin-angiotensin mechanism. Just a summary of renin-angiotensin mechanism, because you've learned this, again you've learned it in blood pressure regulation. We'll just brush up through that. So because of the lack of or reduction in arterial pressure, the blood flow to the kidneys will also come down. When blood flow to the kidneys decreases, what happens? The GFR decreases, and this causes stimulation of the juxtaglomerular apparatus to secrete renin, right? And what does renin do? Renin converts angiotensinogen to angiotensin 1. Yes, renin converts. So kidney secretes renin, and renin converts angiotensinogen to angiotensin 1, which is then converted to angiotensin 2 by angiotensin converting enzyme. Now what are the effects of angiotensin 2? We'll see. Okay, so that's the role of renin. Now what does angiotensin 2 do? Okay. Angiotensin 2 operates through various mechanisms which finally causes an increase in BP. Let's see what those mechanisms are. One is it causes direct vasoconstriction. It has receptors on the blood vessels which will cause direct vasoconstriction. Then it increases thirst by acting on your hypothalamic centers, and so there will be more intake of fluid by the person that will help to improve the ECF volume. Okay. Then there is decreased salt and water excretion from the kidneys. Again, angiotensin has got receptors in the nephrons also, in the tubules also, and so this will cause a reduction in the salt and water excretion. So salt and water is not going out of your body, it is preserved. Okay. Then also it will stimulate vasopressin secretion. Vasopressin has similar effects to that of angiotensin 2, and so together all these things will help to improve our blood pressure. So angiotensin 2 causes vasoconstriction, increases thirst, decreases salt and water excretion, and stimulates vasopressin secretion. By these mechanisms they help to improve our blood pressure. Moving to the next mechanism of intermediate regulation, that is reverse stress relaxation. So during blood pressure control, we had learned when the blood pressure increases, right, through the blood flow, when the blood flow through the vessels, during an increase in blood pressure, what happens? The blood vessels will relax because of certain myogenic mechanisms occurring. The blood vessels will relax, trying to bring down the pressure. That is stress relaxation. During stress, the blood vessels will relax and bring down the BP. This is the opposite of that. When the blood pressure reduces, what happens? The blood vessels will contract around the blood. Okay, it will contract around the blood and it will tighten around and reduce the vessel diameter, thus bringing the pressure back to normal. So when the BP is low, there is less stress on the vessels. That will cause vascular tone adjustment, causing tightening of vessel. The vessels start to tighten, and this will help it will create a situation where the blood volume is available, the available blood volume adequately fills the vascular system. When the blood volume is less, the vascular system will contract down such that a condition occurs where the blood is enough to fill the vascular system. So that is reverse stress relaxation. Next is capillary fluid shift mechanism. So here the Starling's forces, you have to get all your memories on Starling's forces back here, and let's see when there is less pressure inside the vessel. That is what happens here. The pressure inside the vessel is less. Inside the capillary, the pressure is less. That means the hydrostatic pressure inside the blood vessel is less. When there is a reduction in the hydrostatic pressure here, what happens? More fluid will start moving from the interstitial space into the circulation. So that's how capillary fluid shift mechanism helps to improve the amount of fluid inside the vascular lumen. Okay, so there is shift of fluid from the interstitial space into the capillary lumen. Due to a lesser BP, the hydrostatic pressure is low, causing absorption of fluid from the interstitium. So that's about capillary fluid shift mechanism. Okay, so those were the three mechanisms involved in intermediate compensatory mechanisms of non-progressive stage of shock. So let's just summarize what we learned until now. So we learned what are the three stages of shock. What were they? They were the non-progressive stage, the progressive stage, and the irreversible or the refractory stage. And in non-progressive stage, what was the main things that we have to keep in mind, that you have to put in your answer paper if needed? Non-progressive stage is the stage where many negative feedback control mechanisms will help the blood pressure to bring back to normal. Even when no therapeutic interventions are given, the patient can recover here. Usually, patient recovers in this stage. So now moving on to the negative feedback mechanisms involved. It is rapid, intermediate and long-term mechanism. So we learned about the rapid mechanisms. We learned regarding the baroreceptor reflexes, the chemoreceptor reflexes and the CNS ischemic response. We also learned the intermediate responses, the renin-angiotensin, capillary fluid shift and the reverse stress relaxation mechanisms which help to bring the blood pressure back to normal. The next topic that we have to learn is how the long-term compensatory mechanisms will act and help to bring the circulatory pressure back to normal. That we'll learn in the next class regarding the long-term compensatory mechanisms of non-progressive stage of shock. Thank you all.